in the next 1 hour. Okay. So, but invite family, invite friends, and let them join us. So I'm just going to share the video as well so that everybody will know we're live. Zoe Law, okay, on Instagram. Yeah, okay. Just give me 1 minute. Let me just quickly share the video and then we can start. Okay. Please don't go away. I just want to quickly share to those on Facebook and Instagram, YouTube, because they may not see if I don't share. So just give me 1 minute. But I've seen your question about your 9 weeks old who is running at snoring. 9 weeks, and 9 weeks is almost 6 kilos. What was the birth weight of your baby? What's the birth weight of the baby? Just a little bit on the high side for the 9 weeks old baby, 6 kilos. What was the birth weight of the baby? And because you also mentioned that the baby is snoring, and that's actually, yes, I'm worried because obviously the weight of that baby is a bit on the high side, and that may also explain why the baby may be having respiratory issues. So if you are still listening, Zoe, what is the best weight of your baby? And was there any other issues with the baby as well? This is not a vitamin C issue. Your baby was 3.8. Okay. Baby was quite big at birth. And now baby is weighing 6 kilos. Okay. Not so bad, but it's a little bit on the high side. So if the baby is snoring, we need to examine the baby's throat. We need to be sure the baby does not have any obstruction around the airway. So you will have to go to the hospital. I don't know whether you've been to the hospital already, because I can see you said vitamin C. But it's not a vitamin C issue. We need to know whether there's anything blocking the airway of the baby, especially with the information you gave about the baby snoring. So we need all that to be sorted out first, and the baby is a little bit big as well. So we need to be sure there are no other health issues, that make baby to be big at the same time, that will make baby to be having block on the airway. So based on that information, we really want you to see a doctor, preferably in a hospital that has a pediatrician, and then they will be able to examine. I want them to examine the throat of the baby, and if they've examined the throat, if there's nothing blocking the airway, then, because some babies may have some, their airway is still just a little bit soft, and because of that, you hear a lot of noise. I don't think it will be, we won't really call it snoring, but I can understand that for you as a mom, you will call it snoring, but we tend to call it noisy breathing. And they can have noisy breathing, and also if they have cough and catarrh and all that, because that will a little block their nose as well, that can also make their breathing a little bit noisy. But I think the most important thing for us is to be sure there's nothing else that is more serious blocking the airway of the baby. All right, so I will recommend that. And I hope you're also breastfeeding your baby exclusively, because babies who are not on exclusive breastfeeding have, they are prone to respiratory infections as well. So, but exclusive breastfeeding protects your babies against infections, because there are lots of antibodies, there are lots of things in the breast milk that will protect the baby. So those are the things you can do, and make sure you're not exposing the baby to people with cough and catarrh, people with colds themselves, like the siblings who are going to school. Make sure they don't let them be close to the baby, because that is where the baby is getting the infection from visitors, from people bringing the viruses home. So those are the things you need to make sure to protect the baby, keep the baby healthy. All right. Thank you to those who are just joining from Facebook. And thank you so much. Apologies for starting a little bit late. I actually started with my laptop. I mistakenly shut down my um my page where I opened, and so I have to restart all over again. But thank you so much for joining me all the same. Thank you so much, whichever platform you're joining on, Facebook, Instagram, YouTube, you're welcome. This is ATP Live Monday, and again we're still in July, 14th of July, 2025. This is a program where you can get to ask any questions that you may have about the health of your children, and you get to an answer from a pediatrician in 1 hour. But if you have any questions after the live sections, of course, you can say ask your questions on Ask the Pediatrician Facebook group. We're always there Mondays to Saturdays to answer any question that you may have about the health of your children. We've been doing that for the last 10 years, and actually it's our 10th anniversary this July. We've been celebrating all along. So if you're following our page, you'll be seeing a lot of information on about our anniversary and all that. So welcome, thank you, Chiku Juliet. Thank you so much for joining me. And if you have any stories you also want to tell us about your ATP experience, you are welcome to do that on this ATP Live Monday, because it's our anniversary month. So we are happy to take all the greetings. We're happy to take all the nice, kind wishes. We're happy to take all the feedbacks. So thank you so much for those who are joining me on Facebook, Instagram, YouTube. Feel free to ask any questions that you may have. If you are watching on the page or on Instagram or YouTube, just drop your questions directly under the video, and I'll be able to see them and I'll be able to answer them straight away. But if you are watching on our groups, if you are joining us from Facebook groups, ask any of the groups, because we are not live directly in the groups, you have to click on the video and then you can drop your questions under the video. Then I will say it. If you just drop the question directly in the group, I may not be able to say it. So if you are watching on the group, remember that, and please um, feel free to ask your questions. I think Zoe Law, I hope you're still there. I think I've answered the question you asked on Instagram. So she's asking about the baby who is snoring and half cough and catarrh, which has been going on for a while. So we've already said that you need to um, take the baby to the hospital for a proper examination of the airway, because that's the only way we'll be able to know whether there's anything blocking the airway. And if there's anything blocking the airway, we'll be able to correct that. Okay. So if you still have any question, feel free to ask your questions now, and I will be here to answer them. All right. Okay, so let me go back to Facebook. Okay, so good evening. Okay, Shukujule, good evening. Okay, Ismail Ali is one of our moderators online. Nice to have you join us. Thank you so much for all the hard work. These are people working behind the scenes to support HCP. Good evening. Good evening. Everyone is joining now. So thank you so much for joining us. Welcome, welcome, welcome. So feel free to ask any questions you may have. Remember, it's our anniversary month. Let me see whether I can put up our anniversary flyer somewhere on the so feel free to join us. And if you have any question, feel free to post your question. I think I should put this on my background. Okay, so I'm still waiting for the questions. Okay. All right. Mhm. Okay, so we don't have any question yet on Instagram. Not yet. So if you have any question, feel free to post your questions now. Trying to look for questions. Okay, I think I found what I'm looking for. Okay. Let me do my background well. Okay. I think I just put our background there. Oh, I've got a lot of questions. How come they all just rushing now? I guess that must be something from the Lalusha Day. Abiba, thank you so much. All right, so I've got my questions now. Let's answer them. Um, okay, Chico Julia say, please, what are the supplements or vitamins I can give my kids during this school period to boost their immune system? Thank you so much, Juliet, for that question. I actually get asked these questions a lot on what can we give to boost immune system? How do we boost immune system? And it's very important question. The immune system responsibility is to protect us, and they do that all the time. They don't only do that during the cold period, they do it during the hot period, they do it all the time. So the question of protecting babies or protecting our children during cold period is not just, we shouldn't be focusing on only during the cold period. Our immune system should be working all the time. And luckily, most of the time, the immune systems are working without us even knowing. And most of the time, when it comes to immune system, they are usually protein. Most of the agents, the antibodies, those things that protect us against infections, they are protein based. So this is the number one thing that is very crucial when it comes to protecting us is nutrition. Nutrition is number one when it comes to protection against infections and things like that. Is nutrition that is the first thing that we need to prioritize. And this is one of the reasons why, for example, on ATP, we talk a lot about breastfeeding and all that. And a lot of people feel like, oh, you guys are always going overboard about this. Is because we know the importance of nutrition, because those agents that are meant to protect us, they need to be produced, and they're always being used up, and the new ones have to be produced as well. And the way they are produced is through the food that we eat. Um, so we need to make sure that we are giving our children the right food, balanced diet. So they need to have a lot of protein in their diet. And also, apart from the protein, those agents also require some vitamins. They also require some um, um, minerals, what we call, they don't need those ones in large quantities. They need them actually in very small quantities, but we need to give them something as small as our vitamin A, our vitamin C. But we shouldn't be chasing them through drugs or through artificial so-called supplements. We should give them through food. So even the children should eat a lot of fruits, they should eat a lot of vegetables. When they do that, they are going to get their vitamins from the fruits, they are going to get it from the vegetables. So we're not expecting you to go and be buying drugs. Even some people want to say, let me be giving my children vitamin C every day. No, they should take their fruits. That is how to get the vitamin C. not by giving them the so-called packaged tablets or syrup of vitamin C. It's better for children to get the vitamins and the fruits, and the minerals through natural sources, and the natural sources is food. So when it comes to protection, number one is nutrition. Babies 0 to 6 months, breast milk only. Everything they need to boost their immune system is already packaged into the breast milk. You should give them breast milk only. From 6 months and above, to 2 years, breast milk is not enough. You should keep breastfeeding, but it's not enough. You need to now give them other food. For our older children, let them eat well. Let them eat food that has a lot of protein. Let them eat vegetables. Let them eat fruits. They are going to get all the vitamins. They are going to get all the minerals. They are going to get all the things that their immune system need to function. That is number one. Number two is vaccination. Immunization is another way to boost the immune system, because it is not the way the immune system works is that the first time it is exposed, the immune system generates a response. But that response is not always good enough, and that's why children can still be sick. But by the second, third time, the response is increased depending on the kind of germ. So what we do during immunization is basically to artificially introduce the child to the germ, So we're introducing the child to a dead germ, or a killed one, or I'm sorry, my uh, to the one that is already killed, so that the child can have the response, but the child will not have the disease. My phone is so hot, so it has died. So sorry, apologies on Instagram, but I'll come back, let it cool down a bit. So it will have the response, but um the child will not be sick, okay, in a way, but the child will develop response as if the child was exposed to the germs, and that way that child will be protected against those infections. So make sure your children are fully immunized. So since all the vaccines that they should have taken, we say this is so much, and you just take it for granted that parents should know that, but it will amaze us to know that a lot of people don't still take their children for immunization, or they will start, we don't finish, or we mix some things and we don't go back to get those ones that we have mixed. So it's very important that we take our children for the immunization. And of course, you don't say because your children have been protected, they are eating well, they've taken the vaccination, you just expose them to germs unnecessarily. No, we should still not expose our children to the germs. We still need to make sure that we keep them away from people that have cough, catarrh, and all those germs. We need to practice hygiene. We need to teach them how to wash their hands when they sneeze into the elbow. We need to make sure they are, remember the way we're doing during COVID and all that. We need to actually be doing those things regularly. So those are the things we can do to make sure we keep our children safe from germs and infections and all that. And it's something we should do all the time, not only during the cold or rainy season, but all the time. But for the cold season, we keep our children warm. It's really when the temperature is down and all that. Those are the all things we can do. I hope that's helpful, Juliet, if you stay online. Hello, Anna Hama Gala. Say, what causes hole in the heart? That's a $1,000,000 question. So, children having holes in the heart, we will say that most of the time we don't know why. We don't know why. Some of those things just happen while the babies are being formed. But we also know there are some things that can put a mother at risk of having a baby with holes in the heart. So, number one, actually in our own environment, mothers taking drugs when they are pregnant. I see a lot of mothers just saying, "Oh, I'm pregnant, I have cough, I have headache. Can I go and take this? Can I go and take that?" No. No. Most of these drugs we take, most of the time we don't even know we're pregnant. And a lot of us, especially in Nigeria, we like to do all this self-medication. People are always treating themselves for non-existent malaria and typhoid. Those drugs can cause harm to the baby in the womb. This is why we say when you're pregnant, you don't take any drugs. In fact, the first trimester, no drugs except the one your doctors in the hospital have specifically given you, because they are very essential for your own survivor, otherwise you want to avoid drugs apart from your vitamins, your iron supplements, the routine drugs we give in pregnancy. No drugs, no agbo, no hyper concussions. All those things can cause damage to the babies in being formed in the womb. We must also be taking our folic acid. Folic acid for women of childbearing age is something we take every day, not only when we're pregnant. If you are a woman who is likely going to be pregnant or you're likely going to have a baby, you don't wait until you're pregnant to start taking your folic acid, because most of us don't even know we're pregnant. And by the time we know we're pregnant, the baby is fully formed already. So if the folic acid was not there when the baby is being formed, is all the one you are taking after is not going to do anything. If the baby's heart is not being properly formed because the folic acid was missing when the baby is being formed in the first 2 months, when you don't even know you are period from up to 2 months, then that can also cause this malformation, not only of the brain but also other organs including the heart. So that's another thing that can make a mother to be predisposed to a baby with what we call congenital malformation, including holes in the heart. So mothers taking drugs that can cause problem, mother not taking their folic acid, mothers taking other drugs, also exposure to radiation. Sometimes most of us mothers, if you're a woman of childbearing age, when you go for x-ray, they always ask you when was your last menstrual period, because if you're likely going to be pregnant or you're pregnant, you should not be exposed to radiation. That is why they ask that question. So it's not a trick question, and you should always answer it truthfully. And in fact, in some x-rays, if they are not sure, they will do a pregnancy test for you before they do x-ray, because they need to be sure you are not pregnant. Because if you're pregnant, then you're going to put that baby being exposed to radiation is another reason why that baby can have holes in the heart. So those are the common risk factors. There are some women that have certain medical conditions that if you have those medical conditions, you are at risk of having babies with congenital malformation. A very common one is diabetes. So mothers who are diabetic, if it is not well controlled and all that, when their babies being formed, those babies are prone to having heart problems, and also some genetic conditions. If you have those conditions when you have babies, you are likely going to have babies who may have problems in the heart. Also, sometimes some babies themselves, if the baby themselves have a genetic condition, for example, babies whose mothers, babies who are going to have Down syndrome, for example, they can have holes in the heart. So if the baby is born with trisomy 21, that baby, thank you Instagram people for quickly coming back. I apologize, my phone heated up and it went off, so I just cooled it down a bit. Apologies for that. I'm always using it, that's why. All right, so babies who have trisomy 21 or other genetic conditions, that trisomy 21 is Down syndrome, they can also have holes in the heart. In fact, that's one of the problems such babies can have. Babies with Turner syndrome, any babies that have a congenital, like a genetic condition, some of them, by virtue of that genetic condition, they can be predisposed to having holes in the heart. But to be honest, majority of the time, we don't have any reason why those babies have those holes in the heart. It's just one of those things that happens. And, so it is what it is. Also, when babies are born premature, because I can see the baby was born at 32 weeks, sometimes because the heart has not fully, some things are supposed to close baby before the baby is born. So if they are born too early, those old, like we call what patent foramen ovale, they can still be open. But those ones, the good news is that they're going to close shortly after the baby has been born, unless it's really so big that we have to go and close it by operation. So, Eloana, I've given you almost a lecture, one lecture in pediatrics on the congenital heart diseases and the causes of congenital heart disease. So, if a baby has a hole in the heart, please see a pediatric cardiologist and they will determine the type. There are some type that mean the baby looks blue. There are some type that the baby does not look blue. Some we hope the hole will close by themselves. Some they are so big they are causing problem, heart failure and all that. We have to do operation. And these days we are really getting more successful with operation to close holes in the heart. I know it's still expensive, especially for those of us in places like Nigeria where we pay for our health care by our pockets. But even most of our teaching hospitals now are doing the operation. So it's not all the time you have to go to India. There are some common operation for holes in the house that we are now doing in Nigeria. Most of our teaching hospitals are doing them. So make sure you see a pediatric cardiologist and then they will advise you further. All right, thank you. So next question. Instagram people, ask your questions. Apologies for shutting you up, but please ask your questions. Olusode Abibaz Balarin, wow. What is the correct age for a preterm baby born at 34 weeks, 6 days? What do you mean, what is the correct age? You've not told me the current age of the baby, so you have to tell me what is the baby's age now. And if you want me to now tell you the corrected age, then I can tell you. Okay, so we need to, so what you have just told us now is the gestational age of that baby. So for babies born preterm, they have two ages. We have what we call their chronological age. That is the age based on the day, the same way you calculate your own date of birth. So it's the same way you use that one. That's what we call chronological age. But because they were born before 37 completed weeks, we normally need to deduct those extra days that they should have stayed in the womb, or extra weeks that they should have stayed in the womb. We normally need to subtract it from their age based on the dates of birth. We need to subtract it, and that's what will give us their corrected age. And why do we do that? Is that when we want to evaluate preterm babies, we don't evaluate them based on their chronological age. We evaluate them based on their corrected age, the exact age they would have been, assuming they have been born at normal 40 weeks. So that is what it means. So when we're looking at their weights, when we're looking at the developmental milestones, we usually use the corrected age and not their chronological age. Especially for babies that were born so preterm, like those who were born like 28 weeks, the younger they were born, the more impactful that age difference will be. And we'll do that until they are 2 years. So we keep correcting it until they are 2 years old. All right. I got a question from Instagram. How Loretta Moore say ATP has been a huge blessing to my family, and I don't hesitate to invite new moms. So thank you. You are one of our ATP evangelists. All right. Thank you. We can't pay you all for what you're doing. We appreciate. We see your sacrifice. We feel your. Okay, I think it has been cut off. But thank you, Loretta. Thank you so much. We appreciate that feedback as well. All right. So Olusade, if you're still listening, please just tell me the age of the baby now, and then I'll tell you the corrected age. Thank you. Duchess Ojo Shogu. Good evening. My baby of 9 months was given Mrs. 2. Your baby has 9 months is not given Mrs. 2. That is Mrs. 1. Okay, that is Mrs. 1. And vitamin A2 instead of me. No, there's no difference between. So, okay, I get this question a lot. So, mothers, let me first start from what mothers think, then I will tell you what is the correct answer. Mothers think that when we say Mrs. 1 or Mrs. 2, DPT 1 or Penta 1, you think there's a special Mrs. 1, there's another special Mrs. 2. No, there's no special Mrs. 1 or special Mrs. It is the same measles vaccine, okay? So it is the same measles vaccine we are giving you at 9 months. It's the same, exactly the same vaccine we are going to give you at 15 months. They are not different. It's the same vaccine. Why do we call it Mrs. 1, Mrs. 2? The 1 and 2 is going to tell you which number of it you are taking now. So because I get this question, a lot of mom will say, I go for 10 weeks vaccine. Oh, they gave me the Penta 3. Oh, instead of the Penta 2. It is the same Penta. It is the same Penta. It is the same measles. It is the same rota virus. It's the same vaccine. It is not special. There is no special rota 1, special rota 2, special rota 3. It's the same rota vaccine. We are the one putting the 1 and the 2 and the 3 before or after it to let us know how many you have taken. Okay, so Duchess, so what you took today is the same measles vaccine, and it is measles 1. It's not a different vaccine. It is still measles 1. Okay, and even the vitamin A, if this is the first time your baby is taking vitamin A, it is vitamin A. It is the same vitamin A. There's no special vitamin A1. There's no special vitamin A2. They are all the same, okay? But why we put 1 or 2 in front of them is just to help you to know that you are going to take it 2 times or 3 times, and that one will tell you this is the first one you have taken. Then when you take the second one, we call it Mrs. 2 to say this is the second time you are taking it. So when you take Rota 3, we say, oh, this is Rota 3. This means this is the third time your baby is taking Rota. But the vaccine itself is the same vaccine, because I get these questions a lot. Mothers always think our health professionals have made mistake because they think they give them Mrs. A or Mrs. 2, instead of Mrs. 1. It's the same thing. There's no difference. So you don't need to do anything. And you stop saying your baby was given Mrs. 2. Your baby was actually given Mrs. 1. It's the same vaccine. I don't know whether I've explained it. I hope it's clear. Because if it's not clear, let me know. Because I'm trying to see how to explain it to mothers in a way that they understand, because you are not the first person to ask this question, and people always get it confused all the time. So when we say measles vaccine, there's only one measles vaccine. It's not true. There's no any two different kind of vaccines. There's only one measles vaccine. So when we give you the first time, we will call it measles 1, and when we give you the second time, we will call it measles 2. Okay. Vitamin A is a little bit tricky because the vitamin A we give at 6 to 1 year is different from the vitamin A we give after 1 year. So we have the units, we have the blue one, then we have the red one. So before 1 year, we give the blue one is 50,000 units. Then we give you the red one, which is 100,000 units after 1 year. So even though it's the same vitamin A, but the dose is different for vitamin A. And vitamin A, strictly speaking, is not vaccine, because people also think it's a vaccine. Vitamin A is not a vaccine. Vitamin A is vitamin, is food, is normal vitamins. Okay, it's just that we have concentrated it. The unit is so much. So there's a 50,000 unit, there's a 100,000 units. And while I'm at that question, somebody asked because they didn't have vitamin A and they want to go and buy. Most pharmacies don't sell the kind of vitamin A that we give you at the health centers for as part of when you go for immunization. Most of the vitamin A they sell as tablets is usually very small dose. Most of them are maybe 400 units, 800 units. They are very small dose. Those we give in the as those oil, that the oil that they will open a capsule and drop in the baby's mouth. They usually start from 50,000 units, 100,000 units. We even have 200,000 units. So they are different, okay? And most of the time, because obviously we tend to give it for free, most pharmacies don't stock it. The one they stock or sell as part of multivitamins range is usually the tablets or the liquid, and they're usually very low dose. They are not the same dose. Even if you see the high dose like 25,000 one, then that means your child will need to take like 4 of them to get the 100,000 units. So when mothers ask me, if they don't give you the one, exactly the one we give in the hospital, in immunization centers, then you may have to buy a lot of them. So, but the best option is to actually just wait and go back to their center when they have their own, and then they can give it to you. Loretta Moll, okay, say, we see your sacrifice, we feel your love. May God continue to bless you, Ma, and all our amazing doctors, nurses, volunteers, and all ATP Foundation will celebrate you this year, and long and beyond. Long life ATP. Oh, thank you so much. That's a very lovely message from Loretta. You concluded your message. So, Duchess, I hope that is clear. I hope you got the message. Just let me know in comment section you get, because I really want to be sure you got that information, and I want you to help me pass that message on to other mothers who also get confused about that. Okay. So Toby Halaka, good evening, ma'am. Must I give my baby multivitamin? No, you don't. I mean, this one is a very easy one. We don't want you to give your baby multivitamins. It's not necessary. We want you to give your babies food. Okay, let them eat food, and let them eat their vitamins in food. If you are eating well yourself, you are breastfeeding your baby, and you're feeding your baby appropriately, they're going to get all their vitamins. So if you are breastfeeding for the first 6 months, all the vitamins are going to be passed from your breast milk to your baby. From 6 months, when your baby starts taking normal food, then you can give them fruits. So you give them fruits. There are so many fruits, apple, the way you give it may be different. So, you may need to squeeze out the orange out of it. You may need to dilute it a bit. You may need to blend your apple. You may need to cook your carrots. But you can give your baby fruits. You may need to do purees and blend and all that. We prefer you give them the food, to give them the vitamins rather than to give them vitamin drops. So unless for those who are not sure that their babies are eating the fruits. Those are the ones that we now say, okay, just to make sure the baby don't get what we call vitamin deficiencies, you give them vitamin drops. But if your baby can eat, they should eat the fruits and get the vitamins that way. Okay, I got a question on Instagram. And Akinlabi said, what causes reflux in preterm babies? Okay, let's start by saying that reflux is not only in preterm babies. Every baby can have reflux. Almost all babies will have reflux at one point or the other. It's almost universal. And I think I've always explained it for those who are very familiar with ATP, who listen to ATP Live. I give the explanation almost every time. So the reflux, basically, for those who may be wondering, is just babies bringing back part of the milk. Usually it's common in babies who are on milk, either breast milk or formula. When you finish feeding them, then you bring back part of that milk. That bringing back a little bit of that milk is what we call reflux. Okay, now why do babies have reflux? And it's a very common thing. It's a very common issue in babies. Number one, babies' food is liquid. Okay, and the distance between the mouth of the babies and their tummy is very short. It's a very short distance. And most of us, babies are not yet upright. So most of the time they are flat. We are carrying them flat. So, and then there are supposed to be what we call sphincters, like gates that's supposed to close. So when you eat, when the food moves from your mouth to your what we call esophagus and then into your stomach, in between each of them, there's supposed to be like something that should close the space between the esophagus and the stomach. Okay, we call them sphincters, so that the food will not go back. But in babies, they are not yet fully closed gates, so they are not fully matured. So look at the scenario, and baby's tummy is very small. So you have a baby whose tummy is small, who the distance between the mouth and the tummy is just that short, who has taken liquid diets, okay, who does not have a proper gate to close the space between the stomach and the esophagus. And then most of the time when babies are finished eating, then the mother just put them flat. So put them lying flat. So it is easy for the milk to go back from the stomach back into the mouth, sometimes even through the nose, because the distance is short. There is nothing closing it. It's liquid diet that can flow. Okay, so that is why babies have reflux. Okay, it's just a combination of several physiological factors. So what do we tell you to do when you finish feeding your baby? Don't put them flat straight away. Keep them upright. So you allow gravity to allow the food to settle in that tummy. So let them stay upright. You can rub their tummy a little bit, because let the gas come out. Because another reason why they have, especially the forceful one, is because the babies, when they're sucking, when they're taking the milk, they also sometimes, for those of you who bottle especially, they're taking a lot of gas as well, and those gas have to come out. And sometimes in the process of the gas coming out, they also bring some milk along with them. So you can keep them upright, rub their back so that the gas come out gently, and the mix starts to get mixed with the acid and with all the enzymes, and you start getting digested. So after 15-30 minutes, at least a little bit of digestion would have taken place. So the milk would have become thicker and likely going to stay. It's not a completely 100% process. So if you put your baby down, a little bit will still come back, but at least it won't be as much as if you have put them down immediately. So that is what we normally advise for reflux. So it doesn't completely eliminate it. Keeping the baby upright and all that doesn't completely eliminate it. But when babies start to take solid, when they start to sit up by the 6 months and all that, the instances of reflux will begin to reduce gradually. So that is what happened. However, that is a common reflux. However, some people actually have what we call reflux disease, which is different from the normal reflux. So some people actually have what we call the severe gastroesophageal reflux disease. So those ones, all these things I've said, is there with them as well, but they now even have it worse. So those ones, it will be like they're vomiting all the food, they won't be gaining weight, and those ones are more severe. So for those ones, we need to treat the reflux, and then that is when we normally will give them some drugs. Sometimes we even use what we call milk thickeners, breast milk thickeners. We give them something to mix with the milk to make the milk thick so that it will stay down. So we have to give them some drugs, what we call proton inhibitors. We give them some antacids. So we have to treat some babies, especially babies who are losing weight, who are vomiting heavily, who have the severe gastroesophageal reflux. But most babies don't have that severe one. They are gaining weight, they are fine, they are not forceful when the milk is coming out, just a little bit coming out. Those ones, you don't need to do anything. Like I said, as they get bigger and as their food change from liquid to solid at 6 months, and they're now able to sit up by themselves, the instances of reflux will go down. And by the time babies are about 1 year, reflux is not anything to worry about anymore. So I hope, and you got that answer. All right, let's move on quickly. If my phone gets off again because it's still hot, so I'll come back anyway. It's a little bit hot in here as well. Okay, so Toby Alaka, good evening, ma'am. Okay, I've answered that one. Okay, I think I've answered that one, and I've answered the one about babies, preterm babies. I think I've answered that. So OBG Rosie say, can allergy be cured? What do you mean by allergy? Okay, the short answer to that is no. When you're allergic to something, that is who you are. That is part of your life. So we don't talk about curing allergy, but we talk about people outgrowing allergies. But not all people outgrow allergies. So some people have very severe, almost what we call anaphylaxis kind of allergy condition, where if they are exposed to that thing, then they're going to have a very severe reaction. So the solution to allergy is to avoid what you're allergic to. So that is that. That's the simple answer to that. And so you said my daughter of 5 years always sneezes when she wakes up in the morning or whenever she's having her bath. Let me plug my charger. The sneezing as previously accompanied watery eyes. Watery eyes have stopped, remaining the sneezing. So the question is, what is making your baby to sneeze? So that is what you need to deal with first. If you know what are those things that make her to sneeze, avoid. But sometimes it's difficult to know what it is, so we may not always be able to avoid them. But that's the solution, to be honest. But if it's really bad, you can see the ENT doctors. I mean, you have what we call allergic rhinitis, and there are some drugs we give to prevent it or to make it work better, so they can give you those sprays to help it. But she either outgrows it or you have to figure out what she's reacting to and avoid. So it's a little bit tricky either way. Larita is saying 14 months old not saying mama, baba. Is there anything to worry? Usually by the age of 1 year, we expect them to have 1 to 3 words. So 1 to 3 words is what we should be expecting from a 1 year old. So if baby is not saying any word at all, we can give baby a little bit more time and just see whether it does a little bit of a delay. But if the baby is still not talking at all, by age of 18 months, 2 years, you should see a speech therapist. So maybe it's just 1 year, just 14 months old, give your baby a little bit more time. But first, make sure you go and do a hearing test. Make sure the child can hear. Whenever a child is not talking, the first thing we want to know is, can the child hear? So hearing test is important. If the child is turning to sound, when you call their name, they turn to their name, they run when they hear their favorite cartoon song comes on, most likely the child can hear. So if the child can hear, then the question is, the talking, then that's where speech therapists come in. So usually for children, when we say we expect them to do this at social age, if they are not doing it, we usually give them a little bit of time. But we know some babies are just a little bit slower, but there's nothing wrong with them. But if by 18 months, the baby is also still not talking, you have to see a speech therapist. By 2 years, definitely you must see a speech therapist if there are no single words at all. All right. Next question. Hebere Johnson. My daughter of 10 months old just lost appetite in 18 and only 1 breast milk. Why? Babies at 10 months need more than breast milk. So the question is, why is this baby losing appetite? So I don't, I think from my own experience as a pediatrician, I found that babies sometimes are just bored with us giving them the same thing, because some of us Nigerian mothers all we do is for our babies is to just keep giving them pap or cereal all the time, and babies are just bored, so I always recommend, for in this scenario, first check what are you giving this baby to eat. Make sure you're giving variety of food. Don't just give the same pap and milk or only one particular cereal brand every time. It's boring, and sometimes babies just get bored and they don't want to eat anymore. So make sure you are giving variety. Try, there's no food your baby cannot eat. Every food in your kitchen, of the texture may be a little bit different. So when you're starting with porridge, then you move to mash, then you start giving them the real solid, so that is the most important thing, but it's the same food. All right, so make sure you're giving variety. Make sure the food have taste. Some of us will give our baby pap, no sugar, no sweetener like dates or anything, and the food is bland, it's no tasty. The baby, they won't like it really. And then make sure you try different variety colors. Let's make sure the foods are colorful, not the same whitish kind of thing. It's very boring. So I actually recommend you go through our guide show on complementary feeding on our Facebook group. If you are doing all that and you're doing everything, then it's maybe that maybe sometimes they can lose appetite when they are sick. So make sure the child is not ill, and if the child is ill, we get a doctor to have a look. So those are the things that we can do. You can go through all our Facebook group, go to the guide section. If you know you're doing the right thing and the baby is not sick and baby is just struggling with eating, I have a webinar on fussy eaters. Some babies are just fussy. We have a lot of tips for you. You can try that as well, or you can see a pediatrician or a dietitian. Then they can take it forward. But most of the time, it's either the baby is sick or it's just that we're giving them food that the baby is tired of. So you need to try, and sometimes you have to try different things until you know what your baby likes. So just be patient and keep trying, and don't give up. Don't just relax as well. Okay, I think I've answered Richard's question about vitamin A, vitamin B. Okay. uh Han, curious. Okay, you were also on Instagram, you're also on Facebook. Oh, that's interesting. Okay, because I think I've answered the question about, okay, you just want just a feedback. Good evening. Thank for all you do. God bless you richly. Amen. God bless you too. We thank we also got some feedback. Happy 10th anniversary ATP worldwide. Congratulations to all the TPS. Thank you. God bless all of us. Okay. Congratulations. Okay, Arit is one of our ATP our regional director, coordinator for the Northwest and I think Northeast. Thank you. All right, Han is asking, what causes big navel? Okay, that is what we call umbilical hernia. Hernia means so that navel, that is the space where the baby and the mother join together in the womb. So when babies and mother join together in the womb, when the baby is born, we cut it off. So it leaves that hole there. That hole has to close. So when the cord drop, it should close. But in some babies, it doesn't close very well. It still leaves a little bit of space. So when it leaves a little bit of space, some of the things inside the baby's stomach, abdomen, some of the like intestine, like some fats, they can come out through that hole. They come out into the navel, and that is what makes the navel to swell up. That's why you can press. When you press it, it will go down, because you can actually push things back out of that hole and it will go down. Then when the baby cry or smile or laugh, it will come back again. So it is that hole. So sometimes it will leave it because it will close by itself. It's not so big. We'll just leave it and it will close by itself. But in some bits, it's so big, it's so huge, or the things will come out and they can't even go back again, causing what we call obstruction or strangulation. So in that instances, what we have to do is an operation. We have to go and close it. We'll return what is outside back into the abdomen and close the hole. It's a very simple operation that doctors do, but most of the time we don't rush to do it, because if we give babies some time, some of them, the small ones, they will close by themselves. But if it's causing a problem, causing abdominal pain, causing obstruction, it is not going back inside, that is when we will normally need to do an operation to close it. Okay, so if it is very big and you are worried about it, see my colleagues in the hospital and the doctors will arrange an operation to close it. But if it's a very small one and it's not causing any problem, we just give, it's very common in African babies especially, we just leave it and it will close by itself. Usually by the time they're about 5 years max, it will close. But if it is very big and causing problem, those are the ones that we tend to do operation for. Okay. Radeke Bamikefa, please, ma, I would like to know if it's normal why my 3 months fat little poo usually come out. Oh, that is normal. So it's the same place where the poo is coming from, it's the same place the fat is coming from. So sometimes when the fat is forceful, some babies will bring out a little poo with it. So it's nothing to worry about at all. We are not worried about that. Okay, Radhika say, well done. Thank you for all you do. My 3 month baby has a la. Okay, so the issue we have with a la is that it's a Yoruba word for skin rashes. And people tend to use it a lot for all kind of skin rashes. So, and in for us as medical professionals, for pediatricians, there is no one rash that is a la. So people use the lab for allergic rash, they use it for the bacterial rash, they use it for the fungal rash. So when you tell us without seeing the rash, my baby has a la, you have not really tell us any information that will help us to tell you what to do, because you are only told us your baby has a skin rash. So for us to know which kind of rash it is, we need to see it. Okay, because when Yoruba use the word ela, it covers so many different kind of rashes in medicine. It can cover so many things. But when we say it, so for example, if it is a round one that there's discoloration, that tends to be fungal rash. If it's like something that has like pores with water inside, that tends to be bacterial rash. So we need to say it, then that will help us to know what you need to do. Okay, so I always recommend that you can post that picture on our Facebook group. Please don't post pictures showing genitals, don't post pictures of private parts of the children, just areas that we can post. But if it's something in the area that you cannot post online, you have to go to the hospital. But if it's an area you can post online, can tell you, we can give you an idea that this is a bacteria, this is a fungal, or if sometimes it's just an allergic reaction, maybe it's the cream of the soap or the powder that you're using that the baby is reacting to. So we can advise you. So you can do that. But if you are not sure you want to post your baby, that's also fine. You have to see us in the hospital so that we can have a look and then we can advise you appropriately. Thank you. Okay, our time is running up, but I'll try and answer all the questions that has come in. Lina, say good evening. Just joining, came late. No worries, you are still here with us. You said my baby will be 4 months on the 19th. He was born preterm at 33 weeks. Okay, how do I calculate his real age? His real age is 4 months. Okay, I don't know what you mean by real age. There is no fake age. Your baby is still 4 months old. What you are asking about is the corrected age. So to correct your baby, so baby was born 7 weeks before normal time. So if your baby is born 7 weeks before normal time, on the 19th, when your baby is 4 months, you remove 7 weeks from 4 months. So that would be 1 month and 3 weeks. Okay, so let's remove 1 month. That will be 3 months. Then when we remove the 3 weeks, that means your baby will be like about 2 months 1 week. Happy? Yeah, the baby will be 2 months 1 week. So at 19th of the month, your baby will be 2 months 1 week. All right, but the baby is still 4 months old chronological age. We don't throw away the real, according to using your word, we don't throw away that chronological age. So at 4 months, your baby has 2 different ages. The chronological age is the 4 months, and the corrected age is the 2 months 1 week, because we have now taken away the extra weeks your baby was born earlier. I hope that makes sense. If it does, that's fine. All right. Anne is saying, what is the corrected age? Okay, everybody's asking the corrected age. Today is for preterm babies. Okay, actually, your baby is actually similar to the other baby. If your baby's current age is 10 weeks, your baby was born at 33 weeks, so 6 days, your baby is actually 3 weeks 6 days. So take away the 7. It's a very simple math. Take away the 7 weeks baby was born earlier. For us as doctors, the real age baby should be born is 40 weeks. So 40 weeks is the when they calculate your dates for you and say you are going to have your baby on this date, that date is actually 40 weeks. So if your baby is born at 33 weeks, you have to subtract 7 weeks. Okay. So if your baby is 10 weeks, 6 days, your baby is actually 3 weeks, 6 days. So when I'm looking at the weight of your baby now, your baby's weight is 4 kilos. 4 kilos for a 3 weeks old baby is a good weight, which is fine. But if I was looking at a baby as a 10-week-old baby, I would have been saying, oh, 4 weeks looks a little bit on the small side. But your baby is actually still a 3-week-old baby, 3 weeks, 6 days, weighing 4 kilos. That is fine. That is not an abnormal weight at all for the baby. I hope that makes sense. All right. Okay, Lina is asking the same question. You've asked your question twice. I've answered it now. So I think it's okay. So surprise 7 weeks. That's fine. Rennie, thank you so much for your kind comment. Thank you too for joining us. Lina, I said thank for the response, Dr. Bemi. God bless ATP. Thank you. All right. And then Radike Bamikefa, how can I consult ATP professional? Okay, yes, you can consult or just send a WhatsApp message. I think you can see our WhatsApp message somewhere on the screen. If you look at this something that is scrolling across, it has our WhatsApp number there. But if you also just check on our pages everywhere, you will see our WhatsApp number. If you send us a WhatsApp message, that message is actually to our ATP clinics, and then we'll be able to advise you. But if your baby is having reflux, it brings out a lot of milk. I think I've just answered the question on reflux, but you do want to ask question. If you think the reflux is severe for your baby, then I will even actually recommend you see a doctor, because we don't do those kind of cases will not actually even be suitable for ATP online kind of consultation. You need to see our colleagues in the hospital, because if it is severe reflux, like I said, we may need to give medication. And some babies actually have what we call pyloric stenosis. They have a little bit of block in their stomach, and that is different from reflux. Those babies actually vomit, and they vomit what we call projectile vomiting. When they vomit, it's going so far away and it is a lot. So that is different from reflux. Reflux is really a little bit of milk coming out, or even when the milk is much, it's still not forceful. And those babies with pyloric stenosis, they are losing weight. It's more severe than reflux, and I know that for some time mothers can get them mixed up. So if a baby has pyloric stenosis, that baby needs surgery. It's an operation. It is not reflux drugs. So, but if you want to contact us, I've already told you our phone number. Okay, I think that is all the questions. Thank you so much for all of you that came in because of our anniversary to tell us your goodwill message. Today is actually supposed to be just for that, but I just felt we will still keep doing what we normally do. Anyway, we normally still share our stories. Thank you so much. And thank you to all those of us who have been supporting ATP, serving ATP for the past 10 years. It's been amazing. And we thank you on behalf of the Board of Trustees, all our coordinators, all our regional coordinators, all our state leaders, all our volunteers, our moderators, and all the members of ATP. I want to say thank you so much for trusting us with your children. And thank you so much also for being part of our story. So if you still have anything to tell us, feel free to send us a message on Facebook, on Instagram, everywhere. Put it there. I think our graphic team has been reposting some of the messages as flyers. So feel free to keep sending the messages. The whole of July is our anniversary, and if you want to support our ministry, because we need a lot of money, so to do all these outreaches, it will amaze you how much goes into. I'm not going to tell you how many millions ATP has spent in the last 10 years. I won't tell you that, but I just trust me, it's a lot. So, but if you want to support us, feel free to send any token to our account details above, and you can trust that any amount you send to us on ATP goes straight to the care of the children. We don't pay our volunteers, we don't pay no salary to anybody. So everything is to support the children. So feel free to send us your feel free to support us financially as well. So we will be very grateful for your support. Our account details, we take money in naira, we take it in dollars. So feel free to send everything to our account details. And if you have corporate organizations, you want to partner with us, you want to do things with us for the Nigerian children, even African children, feel free to send us a WhatsApp message, email us at askthepediatricians@gmail.com. Just inbox us, do anything, come to us. We'll be very, very happy to work with you. So thank you so much, everyone. Have a wonderful, wonderful rest of your evening. And we are still celebrating. And Sunday is our party. It's going to be massive. It's going to be massive. That's our party. So yeah, how to volunteer. Don't worry, we're going to tell you how to volunteer for those who are asking. Just keep watching out for us. We'll tell you how to volunteer for HCP. I think we'll start bringing it out very soon. We'll do our recruitment before the end of the month. But right now we're still in celebration mode. But we have volunteers all over the country in every state of Nigeria. So we will definitely, and you can volunteer online if you are not in Nigeria, you want to be a moderator, you want to be our financial, and you want to join our graphics team. There are many ways where you can volunteer. So watch out for that. We will share that information very soon. Thank you so much. Have a lovely, lovely rest of your evening, and I'll catch you again tomorrow. No, not tomorrow. We're going to have our celebration on Saturday and Sunday, so I'll catch you then. Before then, have a wonderful evening. Bye bye.